I'm Professor Manju Chhugani, working as Dean Principal, Faculty of Nursing, Jamia Humdard. India produces every year 2,97,000 nurses covering starting from the A&M, GNM, BSc, post-basic, MSc, all levels of nursing professionals from 8,207 institutions as per Indian Nursing Council data 2012. And from these institutions, so many nurses are coming out every year, but many are going abroad because whether it's a rich or poor country, every country is facing a shortage of skilled manpower, specifically in nursing. But the problem is, in rich countries, they can afford to fill this gap by giving good perks, salary and facilities, attracting people from other countries. Therefore, they are able to fill this gap. In India, there is still gap of more than 8 lakh nurses are required, still required, and we are having a good number of nurses coming out from these more than 8,000 institutions. Still we have a gap. And the ratio, if we look at the ratio, there is only 0.75 nurses per 1,000 population, whereas the desired is 12.12 nurses per 1,000 population, which is way beyond our imagination at present. And UK it is 12.12. They are having this ratio. So ratios, if we say, it's a huge gap. And for doctors also, I would say that there is a huge gap. There are 6.5 doctors per 10,000 population, whereas the required number is more than 24 doctors required for 10,000 population. Therefore, there is a gap between the required number and the existing numbers, and in that there are mushrooming of many colleges are coming up, which are diluting the standards of nursing because the number is there but the quality is compromised in those numbers. So I would say that on global map, India is doing very well, but the manpower quality manpower which we are producing is migrating also to other countries due to salary and due to the other attractions which they provide them. In India, the main challenge in nursing is that the skill gap. I would say that skill gap and the learning opportunities which students must get during that time, during their students period, they are not able to get that. If there is a medical college and a nursing college in one hospital, first preference will be given to doctors to get learning opportunity. They get second opportunity or maybe still further later. And then there is also a problem that they are not able to get hands-on experience, and we are not having at the same time the simulation centers which other countries are having if this number is less. So we are not able to make up that either way, and now our government has started with the skills lab in different centers, in institutions, in districts. So we are trying to match up that they should get opportunity to practice on the mannequins, if not getting enough opportunity on patients also. So that's one challenge. Other challenge is that there is lack of leadership in nursing. They are not involved in decision making and policy decision making specifically. They are not there. And also the working conditions, their salaries. You must have read in newspaper recently there was an article that nurses are getting 6,000 also. It is less than the daily wages norms which we have in India. So these are the various challenges, and also as an educator I would say that one of the challenge in nursing is that the syllabus, the curriculum which we have is theory laden, and there is lot of theory which they study, and I never found myself also practicing those things which I studied in anatomy, physiology, microbiology, biochemistry. All that I have not practiced at all. It can be reduced and it can be made competency based on skill based training programs. Nurse in US, I would say that they are they are learning more on the skills and the practices which they are really going to implement in their near future after their course. they study more on, it is interactive learning, more of interactive learning. And then when they go in the clinical area, there are mentors, preceptors who teach them the clinical skills there. And they are all the time supervised there also in clinical area. And in India, I think we overload them with lot of knowledge and skills as well, but it is lesser. What they need later on, it is not much of interactive learning, it is more of a lecture kind and demonstration type, but it requires more of interactive learning and more of competency based learning. That's the difference. And now in India also you will find nurses practicing in a similar fashion because of the hospital. Hospitals are having SOPs which they follow. In other countries also they have SOPs laid down for every small procedure also. So they will follow same guidelines, same steps they do. And in India also, like in many hospitals in corporate sector, they have SOPs and they work based on that. So it's a standardized and quality care. I feel that one buzzword for improving the nursing scenario in India is that political commitment is required. And when there is political commitment, I think other things starts moving easily. And I have put forward my request also to the ministry that we should have a committee to make nursing reforms on nursing reforms. If we do that and we discuss the various issues, challenges which we have discussed here in that committee and come out with the draft or recommendations to improve the nursing scenario in India, I think would be a better option. If you want to improve any profession, you need to improve the education, you need to improve the regulation, you need to also improve the association. These are three important pillars of any profession you take in India or abroad. These three pillars, if you simultaneously improve, a profession can be strong.